Hello everyone. So in last NEET SS, we got around 2 questions, right? Which directly asked, tell me which pattern. What is this pattern? They gave different pattern, organoid pattern, some in seeds, some in fascicles, and they asked, tell me which pattern is this tumor, right? Just pattern. They didn't ask anything regarding the tumor. They just asked pattern. So I thought I will make a small video. It's kind of a kind of a game only, kind of a quiz to learn the patterns in histopathology, right? So shall we begin? Just a small video only. Yes. Identify the pattern. I won't say I want the pattern. I don't want the diagnosis. Any pattern. Yes. What is the pattern? I have shown you this picture and I want this pattern. Right? What is this pattern? Yes. Many of you have diagnosed. This is nothing but a BCC. And if anything is resembling this BCC, it's referred to as Basaloid pattern. Right? It was nothing but a, even if it's a squamous cell carcinoma, it's nothing but a Basaloid squamous cell carcinoma. So it's resembling BCC, the one having high N ratio, and maybe in some cases Palisading is there definitely in BCC. The stroma, the stromal clefting, the mixed stroma, that is there in BCC. I am not here to teach BCC here. I am just wanted to appreciate the pattern, Basaloid pattern. Maybe in basal cell adenoma, in adenoid cystic carcinoma, and in n number of tumors you can have Basaloid pattern. Right? Okay. Next. What about this pattern? Yes, I have given the normal structure here. I want you to identify this pattern. Yes, what is this? Yes, this is nothing but a lung alveoli, right? And the same, if you are getting same pattern having discohesive cells in the middle, and of course we have discussed in the soft tissue this one. Which tumor this is? Any idea? Yes, ASPS, right? So this is nothing but a alveolar pattern, right? You can have alveolar pattern in case of say alveolar RMS also. What about this pattern? Again, I have shown you a normal structure. Normal structure. Tell me the patterns. What is this? What is this? Any idea? Yes, nothing but chicken wire, right? The chickens are kept under this wire, chicken wire pattern. If you are getting this pattern of calcification, can you see? Yes, if I can highlight here, yes, these are the calcification area. Chicken wire calcifications. That's quite classic for which tumor? Yes, chondroblastoma. Right? Just appreciate the pattern. Chicken wire calcifications. Even chicken wire vessels can be there. In case of, this is myxoid liposarcoma actually, and there you can see this kind of vessels. Yes, this kind of vessels, branching vessels, right? Curvilinear branching vessels. These are nothing but chicken wire vessels. That's again seen in myxoid liposarcoma. In many cases also, even in lipoblastoma, you can have chicken wire vessels. Myxoid liposarcoma, right? Of course, you will not confuse myxoid liposarcoma with lipoblastoma, because lipoblastoma is something happening in case of child, and myxoid liposarcoma is happening in cases of adult, right? Okay, if I don't want to prolong the video, but still myxoid liposarcoma associated with which mutation? EWSR1, DDIT3. Hope you remember that. And any other question like myxoid liposarcoma, they can ask MDM2. Is it positive? Right? Negative. MDM2 is a negative in myxoid liposarcoma. Cool. Okay. And this one, what is this thing? This is nothing but crowfit. Even the vessels, many they told it can be a crowfit like vessels. Okay, anything is okay. Either chicken wire or crowfit, whichever god you are fond of, you can name accordingly. Okay, which pattern? The moment you say cheese, everyone will say it's a Swiss fish pattern or cribriform pattern, isn't it? Which tumor? Adenoid cystic. Clear. Okay, which IC will do for adenoid cystic? Answer is nothing. Nothing adenoid cystic, no IC is there specifically for adenoid cystic. Of course, you can do CD117 to highlight the luminal component, and myopithelial component abdominal component can be highlighted by P63. But one thing I can tell you, I've already told you in the salivary gland chapter, these things, these stuffs what you are seeing, these things, are they true cyst or pseudocyst? Yes, just for a second, just quiz kind of asking. It's nothing but a pseudocyst. Why? Because they are not true cyst. They are in fact actually they are entrapping the stroma itself. Like this is the stroma, right? And this stroma is in fact entrapped by this cyst. Yes, here also, everywhere. Most of the time they are pseudocyst. Sometimes you can see the stroma going inside also. So it's the stroma that is being entrapped by this basaloid cells of adenoid cystic carcinoma. It's not a true cyst. That's what you need to remember. Okay. What is this pattern? Again, what is this pattern? Any idea? This is no pattern. I think it's just a discohesive pattern. Discohesive pattern. Yes, but once you are telling discohesive pattern, at least you are the moment you say discohesive, you are thinking in line of any hematogenous tumor, lymphoma, or say in LCIS they can have discohesive pattern, or it is undifferentiated, right? That's a discohesive pattern. Okay, what about this pattern? Just a broom, right? Long broom I have shown. It is nothing but, can you see this? Yes, fascicles, right? Fascicles. Where you will get these fascicles? Yes, you can see these fascicles. Yes, in case of leiomyosarcoma, you can get this pattern, fascicular pattern. Okay, what about this? Again, I have shown you. I'm sure you must have told by now. Herringbone pattern, right? Herringbone. Can you see this? Yes. Here we have, and these are the kind of bones belonging from it. Herringbone pattern. Again, seen in which tumor? Which tumor? Fibrosarcoma. Many other you can get herringbone, but fibrosarcoma is the prototype. And what is the IC for fibrosarcoma? If I can ask you one thing, fibrosarcoma. Yes, it's a diagnosis of exclusion. No IC will help you. What about infantile fibrosarcoma? Right? Just because there is a quite interesting mutation, translocation associated with it. It is associated with, yes, ETV6 and TRK3, right? Just because infantile fibrosarcoma is associated with this, that's become a question. And infantile fibrosarcoma, already I have told you how there is prominent lymphoid infiltrations, right? Clear? Okay, next. Identify this pattern, Yes, any clue you need? Obviously, I have given you the tumor itself. Nothing but Indian file pattern. Why Indian file? Why they are called Indian file? Previously, I used to think some files are kept like this, line by line. That's why they say that. But it's definitely it's not like that. It's a the American Indian people. They told that they are while shifting, they will walk in a trail, right? And that is giving giving this name Indian file pattern, right? The same what we get in case of our invasive lobular carcinoma, Indian file pattern. Okay, okay, fine. What about this pattern? Yes, I've shown you this pattern. The term comes from this entity. Yes, this is nothing but protrusion of the cells. Can you see this? Protrusions. Yes. What is this? Protrusion of the nuclei. Is it nuclei trying to protrude outside? What is this? Also, some say it's a matchstick kind of pattern. It is nothing but Hob-nailing pattern. Okay. You answered that? Good. Hob-nailing pattern. Hob-nail, actually the term comes from the nail. It's the nail. The nail that is used to give grip to the shoes, right? That nail, that heavy-headed nail to reinforce the sole of the foot. That's the Hob-nailing pattern. Where you get this Hob-nailing pattern? You can say anything. Many say in Hob-nail hemangioendothelioma. Although the term is not now used, we can use either retiform hemangioendothelioma or Dabska pattern, isn't it? Dabska is also not used. They used papillary lymphatic hemangioendothelioma. Anyway, that and also in case of, yes, many other are there, like say clear cell carcinoma. There also you can get Hob-nailing, isn't it? Okay. What about this pattern? Any idea? What about this pattern? If I can show you, it is nothing but a island-like pattern, right? Surrounded by some stroma like this, right? And again another island will be there, right? This is also referred to as island pattern. In fact, the name of this pattern comes from this word island. What is that? It is insular pattern, right? Insular pattern. Where you get this? Where you get this? Yes, yes. In case of carcinoid tumor, you can get it, right? You can get. You see, next some patterns are overlapping. They can say nesting here also, but insular is the preferred term. Yes. What about this pattern? Another pattern. I've shown you the lesion. It's not a tumor. It's definitely if you are having a good dermatopathology posting, you can identify this. Yes. What is this? Nothing but pemphigus vulgaris. Like it's the vesicle, and here you have the one we say row of tombstone, isn't it? Row of tombstone appearance. That's the pemphigus vulgaris pattern. But it is the pattern is referred to as garland type of pattern or festoon type of pattern. See, festoon, right? Festoon pattern. What is this festoon pattern? Here it's like a ornament which is suspended in between these 2 points. See, 2 points are there and ornament is suspended. 2 points are there, ornament is suspended. Like it's representing this picture. See, it's like 2 points are there here, and the dermal papilla is projecting into the blister, right? See, 2 points are there, and we have it's the dermal papilla, the tip, they are presenting into the blister. That's a garlanding pattern or festoon type of pattern. Just a terminology, right? What about this pattern? I not tell you, this is nothing but glands, right? Glandular pattern, right? Or some say tubular pattern, or you can say ductal pattern. Anything is all right. Prototype example is nothing but adenocarcinoma. Any adenocarcinoma will have this pattern, right? Clear? Okay. What about this pattern? Any idea which pattern this is? We have a large, origin, and gradually they are dividing in a hierarchical manner. Can you see hierarchical manner? They are dividing. Yes, the term is referred to as filigree pattern, right? Filigree pattern. Again, pathologists are very fond of these patterns. That's why they have named filigree pattern and all. What is this tumor? If I will say it's a ovarian site, right? Yes, it is nothing but a ovarian serous carcinoma, right? And even in maybe a borderline or serous carcinoma, but because of this hierarchical branching, that's a very prototype of borderline serous borderline tumor or serous carcinoma. Or you can have also this micropapillary carcinoma, right? Ovarian serous micropapillary carcinoma. Filigree pattern. What is this pattern? This pattern again. Yes, you won't have time. In quiz also they will give you rapid fire question. Which pattern? Which pattern? Yes, nothing but a geography, right? It's a geographical map, right? And if you are getting geographical necrosis, tell me where you will get geographical necrosis. Some will say we get in GBM. In GBM you get palisading, of course geographical, but palisading necrosis, the term is used. Geographic necrosis is found in case of vascular conditions like Wegener's. In Wegener's, you can get geographical necrosis, right? That's the pattern. Yes, what is this pattern? I've already highlighted here the normal things. This is nothing but the glomeruli. And if you are getting such structures, say if I will say you can get this glomeruloid pattern. Shall I write it here? Glomeruloid pattern. Where you get it? In case of prostatic adenocarcinoma, right? Next question will be which grade? I mean glomeruloid, cribriform. What is the Gleason score you are giving? 4, right? Okay. And glomerular pattern also you can get it, say in hemangioendothelioma also. In case of papillary intralymphatic hemangioendothelioma, they will have papillary tufting, glomeruloid vessels, everything is there. That's the glomeruloid pattern. Okay, what about this pattern? Normal I have shown you, Gyri and sulci I have shown you, so you must be telling that this is nothing but gyriform pattern, isn't it? Again, where you get this gyriform pattern? Just like the interconnecting gyri of the brain, you can see this interconnecting areas. Nothing but in a carcinoid also, you can get gyriform pattern, right? Okay. Again, another pattern, right? The pattern is like scale-like, and I have shown you the tumor. right? If I tell you the site, you will definitely jump to the pattern. Let's say I will tell it's a lung tumor, right? Alveoli are intact, but the tumor is, creeping in case of in the alveolar walls without destroying, without causing mass destruction. Yes, you are right. It is lepidic pattern, right? Okay. What about this pattern? Yeah, even the name is quite classical, and it come from this name. This is a normal tissue. Identify this normal tissue. What is this? Yes, fibrofatty. Yes, it's a fibrofatty tissue. Fibrofatty glandular tissue. What is that? Yes, nothing but a breast, and these are nothing but TDLU, terminal duct lobular unit. And this lobular pattern, you can see in many tumors. The prototype again is lobular capillary hemangioma. Just one example I have shown you: lobular capillary hemangioma, or what is the misnomer? Pyogenic granuloma, commonly used term, but neither there is a pus nor there is any granuloma. Right? Better use lobular capillary hemangioma. This pattern again. What is this pattern? Normal thing I have shown you. It's a nest. So nesting pattern. See, this tumor is nothing but a nested variant of urothelial carcinoma. So if there are irregular sept, variably sized irregular sept nest, these are nothing but nesting pattern. Just an example, nested variant of urothelial carcinoma. What about this pattern? Which pattern you think? Any idea which pattern this is? You can get, this is nothing but you can get glands. This tumor I will say, this is you can get glands. You can get ribbon-like pattern. You can get trabeculae, right? You can get rosettes. Hope you know the difference between trabeculae and cord. See, cord is like a single row of cell, whereas trabeculae is multiple, cords. If they are joining together, that's a trabeculae, right? So trabeculae pattern, cord pattern, ribbon pattern, glands pattern, rosetting also you can get. That's the architecture. And if once you go to the cytology, you will be getting, what is this? Stipple chromatin, right? What is this pattern? Yes, the pattern itself is the tumor. It's the neuroendocrine pattern, right? You can have different tumors having neuroendocrine pattern. That is so classical that they have given a different name. And believe me, one thing you need to know regarding neuroendocrine, that they are monomorphic. Very, 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 very important. Wait a minute. So monomorphism, that is very important. That will help to tell that it is a neuroendocrine tumor. I got that in my final exam also, in my MD examination. They brought a slide that's a neuroendocrine tumor in case of pancreas, but it was in a gland. So I told sir maybe adenocarcinoma or neuroendocrine, but he told which one you think, which will give as a first DD. I say it's a neuroendocrine tumor. Why? Because it's monomorphic, right? Very bland looking tumor. That's a neuroendocrine tumor. That's the characteristic. Rest you can get glands, ribbon, whatever. What about this pattern? Yes. What is this? It is nothing but a papilla. It's a papilla, but there is no vascular pore. Tell me now, what is this pattern? Nothing but a micropapillary carcinoma, right? Micropapillary pattern, right? And that you can get in any, say, this is a DCIs with this micropapillary variant, or you can get micropapillary carcinoma. Okay, if micropapillary carcinoma, good prognosis, bad prognosis. Just a quiz like. It is having bad prognosis, having a lymphatic metastasis, and which ISC will highlight the abdominal border. Hope you remember the EMA, right? I've already discussed in case of breast topic, you can see that. Yes, what is this pattern? Again, maybe in soft tissue I have discussed this pattern many times. Is it visible, this color? Okay. This one might be visible. White will be visible. Yes. This pattern, back to back arrangement. If you are getting, it is nothing but organoid pattern, right? Cells are organized in nest mainly actually. Organoid pattern, right? See, once I say organoid pattern, see, what is the importance of telling organoid pattern is that if you will never think of a, say, tumor like lymphoma, right? You will never think of a lymphoma once you are writing in the description organoid pattern, right? Of course, you can use the term nesting and all, you can use, but definitely lymphoma is out once you say it's an organoid pattern or it's a cohesive pattern. Okay. What about this pattern? This pattern. We have already discussed this in breast, and I will ask you the question also which I have discussed there. Yes, which pattern is this? This is nothing but a pagetoid pattern, right? Pagetoid pattern. In breast, we have seen how from the duct, the DCIS component are going onto the epidermis, pagetoid pattern. Also, but this is not a Pagets disease, right? Why pagetoid is used? Because it is nothing but a case of Bowen's disease, right? Bowen's disease. It's nothing but a squamous cell carcinoma, right? How to differentiate? Already I have told you that. Pagets disease and Bowen's disease. How to differentiate? Will CK help? Yes, answer will be yes. But will you use pan CK? No. We have to use high molecular cytokeratin and low molecular weight cytokeratin. Now, where you have to use high molecular weight cytokeratin? In the epithelial component, the one which is exposed to strain, right? So, high molecular weight cytokeratin like CK903, suppose CK903, that will be positive in squamous cell carcinoma and negative in pagetoid. Whereas low molecular weight cytokeratin, right? Say CK7 will be presenting in pagetoid, in Pagets disease of breast, whereas negative in case of Bowen's disease, isn't it? That's an MCQ actually. Where is low molecular weight cytokeratin? Where high molecular weight cytokeratin? That we have already discussed. Pagetoid pattern. Which pattern is this? Yes, nothing but a fence, palisading. This is, you can say, palisading pattern, right? That you will get in BCC, already I have shown you. Or in case of cyto also you can get picket fence pattern. Heard of it? Picket fence pattern. Yes, nothing but the normal endocervical epithelium. If you see in pap smear, you will get this pattern, right? And of course, this kind of palisading, you can also get, say, palisading granuloma, you can say. Not this kind of palisading granuloma. You can get it where? That's an MCQ again. Rheumatoid nodule. Just a brush up. How far you have understood the topic? Rheumatoid nodule. Okay. What about this pattern? Any idea? See, this is a vessel. Here a vessel is there, and as and when the tumor which is close to the vessel, they are alive. They are alive. But the one which is far away, they have died and undergo necrosis. Now, this pattern is also referred to as, if I can write it here, peritheliomatous pattern, right? Where tumors surrounding the vessels are intact, while the tumors which are far away have undergone necrosis, right? Any high-grade neoplasm which has outgraded the blood supply can give this pattern, peritheliomatous pattern. Okay, here we have a papilla, but now core is there. Stroma as well as vessels, everything papillary core is there. Nothing but a PTC, right? I did not tell you that. Okay, what about this pattern? Yes, I have shown you a spider web, but this pattern actually, if I will tell you, it is present in York-sac tumor, classically, York-sac tumor. What is this pattern? Now you can tell me. Yes, reticular pattern, right? Every pattern, everything can be a question. Reticular pattern. Yes, here we have. These are nothing but worms, a bag of worm kind of. And the moment you cut it like this, the moment you cut it, the transverse section in the slide, you'll be seeing this pattern. What is this? What is this? Nothing but plexiform pattern. Either in neurofibroma, either in schwannoma, plexiform, histocytic lesions, you can get it. Okay. What about this pattern? These are kind of an epithelial component only, but they are looking kind of a spindeloid, kind of ovoid kind spindeloid pattern. In fact, the term is referred to as Sarcomatoid pattern. This one is vague pattern. Actually, they will not ask you this one, Sarcomatoid pattern, but you can get Sarcomatoid pattern in RCC. And if it is Sarcomatoid pattern RCC, which IUCP grading? Any answer? Yes, it is grade 4. Okay. Even if you don't have those prominent nuclei and all, you get sarcomatoid component, you get rhabdoid component, it's IUCP grade 4. We already discussed that, right? Okay, which pattern? Again, another pattern, nothing but rosettes, right? And in rosettes, they say true rosette, false rosette. See, I thought that true rosettes. See, in mnemonic, I thought if you are a true person, do you think you will have anything inside, right? Nothing, right? Everything is, you don't keep anything inside. So if there is no inside component, that's a true rosette, like this one, true rosette. If there is the lumen is empty, that's a true rosette. Whereas the rest are false rosette. Now, among false rosette, either there can be vessel inside, right? Can you see? This is nothing but perivascular. I can write it here. Perivascular pseudorosette. Where you get it? Perivascular pseudorosette. Yes. Bear with my handwriting. It's ependymoma, right? So in ependymoma, you can get this false rosette. Another in true this rosette, this true rosette. Where you will get? Yes, flexor intestinal. Hope you have thought of the diagnosis. Flexor intestinal rosette. Where you get it? Retinoblastoma, true rosette. In carcinoid also can get true rosettes. And this one, Homer-rise rosette. This one having fibrillar processes, right? Also, I can write Homer-right rosette, not true actually. Homer-right rosette. Where you get this? In neuroblastoma. Fine. So rosette you should not be having a doubt. They might be having vessels. They might be having the true false. You might forget, but they might be having an empty lumen or having a fibrillar process. The tails, the neurites forming the lumen, right? That's the Homer-right rosettes. Here is the perivascular ependymal pseudorosette. Here is the flexor intestinal rosette that we get in retinoblastoma. Okay, another pattern. By seeing the snake, you should say which pattern? Snake-like or serpentine pattern, right? Serpentine pattern usually they say in case of neural tumor, you might get this pattern. Vague pattern. They won't ask you this one. What about this? This is definitely a classic pattern. What is this? Nothing but a spoke wheel kind of pattern. Yes, storiform pattern, right? And storiform pattern you will getting in this tumor. Can you see the storiform pattern? Can you make out? Yes, just like it is originating from a single point, and or the intersecting spindle cells are in centrifugal sprayed from a single point. It's a storiform pattern, right? Seen in? Yes. Anything. In case of DFSP, you can get, right? Dermatofibrosarcoma protuberans. Okay. Just because I am telling about DFSP, which I see, it is CD34. Okay. But when it is lost, you must be thinking about conversion to fibrosarcoma. Okay. What about this pattern? I have already shown you. Staghorn pattern. Your favorite, I know that. Staghorn pattern. And the vessels, these are the vessels. Nothing but dilated, irregularly branched vessels. Which tumor? Which tumor? The moment you ask it, I will ask you another question regarding it. And that was the last NET MCQ. Nothing but NAV2 Stat 6. Hope you remember the ISC, CD34 and Stat 6. They won't ask you this question. These are the UG level questions. They will ask you what are the criteria used for risk stratification of SFT. Right? Hope you remember. Everyone will say mitosis, necrosis. That examiner don't want to listen. They want you to listen. Size. What else? What else? Apart from this mitosis, necrosis and size, yes, A's, patient A's. Hope you remember. And what is the paraneoplastic syndrome associated with SFT? That's the question again. Hypoglycemia, right? And because of IGF-1, acromegaly, right? That's the question in SFT. Just for a quick revision. Yes, what is this pattern? Anyone? Which is this pattern? The moment you see it, you should be diagnosing the tumor itself. That's the classic prototype. Yes, this is nothing but a syncytial pattern. You know, I hope you know what is syncytial pattern. Here the cell borders are not distinct, right? If you see any nest, there is no cell borders. You can see just the nucleus. Doesn't mean cell border is not there, right? But they are not distinct. And that's syncytial pattern. Classic for meningioma, isn't it? Even in Greek, the syncytium term is referred to as being together. So that's there in case of meningioma. Okay, what is this pattern? Already I've told you. Yes, what is this pattern? Just resembling the bony trabecular pattern, right? Trabecular pattern can be seen in anything, like say carcinoid. This is a carcinoid tumor, trabeculi. Hope again I already told you difference between trabeculi and pod. Okay, what about this pattern? You are getting a growth, cauliflower-like growth. That's nothing but a verrucous pattern, right? What like growth if you are getting? It's a verrucous carcinoma or verrucous hyperplasia. No, verrucous carcinoma. Okay. What about this pattern? Another pattern. It's look like there are, in a petri dish. Hope you remember in petri dish, right? You are seeing the cultured fibroblast. Like, now you can tell me the which pattern I am asking about. Yes, it is nothing but tissue culture-like pattern, right? Where you are getting this pattern? Any tumor, tissue culture-like pattern. You can get it in inflammatory myofibroblastic tumor. Whereas in case of nodular fasciitis, the myofibroblast will be having a tissue culture-like pattern. And just because I am asking about nodular fasciitis, can you tell me which rearrangement? Right? Yes, is it USP6? If it is USP6, which other tumor is associated with USP6? Aneurysmal bone cyst. Hope you remember that. Okay. What about this pattern? Yes, nothing but a whorling, right? Whorling pattern. And this tumor, if you can see, in case of meningothelial meningioma, the kind of whorling pattern, isn't it? Cells are spirally arranged. What about this pattern? Yes, looking like a tall villi, nothing but villus adenoma. Villus adenoma, right? It can be a villiform pattern, villi-like pattern. What about this pattern? The last one, right? If yes, any idea? If I will say it's a tumor arising in the adrenal gland, yes, a ball-like morphology, cluster nesting-like morphology, also referred to as gel-valen pattern. So that's it. I thought of making a small video, and in between I told silent points regarding the tumors also. Thank you. All the best for your upcoming exams, and yes, if you get any more patterns, or if you get any more points, please you can get back to me, and hope we will continue this process of learning together. Thank you all.